More than 5,800 new coronavirus cases were added to the state dashboard today. And Pima County has asked some businesses to voluntarily shut down to try and get this COVID surge under control. A voluntary request, but one local business owner says he's disappointed in health officials even for asking. News 4 Tucson's Eric Fink joining us live in Midtown with our story. Hello, Eric.
Hello there, John. We're 9 months into the pandemic now, and the state health department is changing benchmarks for businesses to be able to stay open, just as the Pima County Health Department are pleading with these same businesses to do all they can to slow the spread of the virus. Just yesterday, the chief medical officer here in our county asking gyms like the one behind me to voluntarily close their doors.
I think it's a challenge, especially around Christmas time, to ask your staff to just go home and not be able to get a paycheck.
Ron Yousefnejad has owned Prestige Fitness in Midtown for the last 11 years. It's a small privately owned gym that Yousefnejad says is abiding by all the state requirements, including a mask mandate inside and limiting capacity to no more than 25%. Monday, a health advisory from Pima County asked gyms to close temporarily, something Prestige Fitness won't do.
This isn't an airplane where you're sitting right next to the individual for hours at a time. This is an indoor-outdoor facility. We limit the number of people that are coming in. So I found it very disturbing that they would ask that of locally owned businesses that are following the guidelines to do that.
The state health department has now changed benchmarks it set forth this summer to try and keep as many businesses open during the pandemic.
And when we looked at it and made those benchmarks, that was before we knew what kind of mitigation strategies would be put into place and what all of the things that we know now about the virus.
Will Humble with the Arizona Public Health Association says he's not thrilled about closing bars and restaurants for dine-in service, but he says at the moment the state's not doing enough.
The governor and Dr. Christ are not using the evidence-based tools that we have to slow the spread of this virus until we can get more vaccine into some high-risk populations.
Christ argues she and her team have to take a look at the health of the community as a whole.
Housing and food access and health insurance and access to a job all play a role in the overall health and long-term outcomes of our community.
I also would point out to Dr. Christ that the governor has hundreds of millions of dollars of CARES Act money to create the very safety net that she's talking about. Where are we as citizens to go? I mean, we put ourselves in a box in which a couple of people are making the decisions for 7.2 million of us, and it's not turning out so well.
And Humble says we are sitting at the edge of a cliff, one he fears that will about to be headed over if more mitigation efforts aren't taken soon. We've got you covered live tonight near First and River. I'm Eric Fink, News 4 Tucson.